Good afternoon. My name is Charity Love, and I'm a registered nurse here at Mount Sinai Medical Center. We're here today to talk a little bit about early and late complications status post tracheostomy placement. We're going to start today here in the simulation lab. Our patient's name is Mr. John Doe. He has just returned from the OR, status post tracheostomy placement. First and foremost, when you receive a patient from the OR, status post tracheostomy placement, you want to complete a head to toe assessment, paying close attention to their initial set of vital signs. As I perform my assessment, I'm going to hand sanitize, place my gloves, what we're first going to look for is we're going to look at the placement, make sure the cannula is intact, it has not been dislodged, the dressing's in place. We're going to make sure that the cuff is inflated. You can check that by this bag here. You want it to be able to push it. It should be firm to the touch. Other things you're going to want to look at, is there a lot of increased secretions? Is there a lot of increased bleeding around the trach site or inside the cannula? If the patient is connected to the vent, you want to make sure that their inspiratory, expiratory, those waves are going up and down, and that they're actually oxygenating well. How do we know that they're oxygenating well? Well, we're going to perform our first set of vital signs. Our vital signs, which would include your oxygenation as well as your blood pressure. Very important that you pay close attention to the oxygenation. If a patient starts to desaturate, you can troubleshoot this problem in a couple of different methods. It could mean that the patient has increased secretions. If that's the case, you would likely need to suction your patient. How do we go about suctioning the patient? Well, first and foremost, you want to hyperoxygenate the patient. With the ventilator intact, you're going to walk over to the vent, push the button on the lower right-hand corner that says suction. What this is going to do is this is going to provide the patient with 100% oxygenation. This is going to hyperoxygenate your patient in preparation for suctioning your patient. If by any chance this is unable to be performed, you can also hyperoxygenate your patient utilizing an ambu bag at the bedside, connecting it to the tracheostomy, and pumping it. After you've hyperoxygenated your patient, you're going to want to go ahead and perform the inline suctioning, maneuvering through the cannula. Suction on your way back out intermittently. You can do this up to 3 times. Now this is troubleshooting if you see that they have started to desaturate, and it could be because of increased secretions. Another complication is risk for bleeding. So you want to carefully inspect, is there a large amount of blood near the trach site where the new tracheostomy has been placed? A huge important vital sign that you want to pay attention to when a patient is at risk for bleeding is the blood pressure. So you want to carefully monitor the blood pressure. Make sure that the blood pressure isn't suddenly starting to drop. Things that you can expect if you start to see this complication is you might end up drawing lab work, such as your H&H. Other things that you could be a complication, early complication status post tracheostomy placement, are a pneumothorax. So if you see that your patient is starting to desaturate, what you want to do also is you want to listen to lung sounds. You want to make sure that you're hearing air moving clearly in and out of each of the lobes. You should have your stethoscope present. You want to listen carefully to both the upper and the lower lobes, comparing each of those to make sure that there is air movement in each one of these lobes. If you've determined that there is a lack of air movement in any or all, hopefully not all, of these lobes, some things that you can expect to be done would be an emergent chest x-ray to determine if there's a possible pneumothorax. Other complications, status post tracheostomy placement, is sub-Q emphysema. What is sub-Q emphysema? Basically, to assess for that, you could palpate around the epidermis of the skin, feeling for little bubbles that crackle when you palpate them. This is trapped air. This could be an indication that there is sub-Q emphysema. Another complication is a pneumomediastinum. This is also trapped air, but this is trapped air deeper inside the lung tissue. This also can be helped to be determined through a chest x-ray. If you suspect any of these early complications, status post tracheostomy placement, It's very important to contact the physician immediately because a lot of these complications, you'll need to do emergent possible imaging or lab work. Some late complications from tracheostomy placement includes decannulization as well as risk for infection. Now, if say a patient coughs very heavily and they end up decannulizing themselves, you need to contact the physician and anticipate that you're going to be replacing that inner cannula. You will not be putting it back in. You will be replacing it because our inner cannulas here are disposable. They will be thrown away and you'll replace it with a new one. For risk for infection, it's important that every 24 hours you perform adequate site care as well as exchange or replacement of the inner cannula. If the inner cannula is disposable, which the majority of the ones here at Mount Sinai are, you will be taking it out and replacing it with a brand new one. If it is not disposable, you will be providing cleaning to that inner cannula and replacing it. Those are some of the late complications for tracheostomy placement. I hope you've enjoyed our brief little in-service on status post tracheostomy placement. Have a wonderful day.